So welcome, everyone. My name is Dr. Margaret Riley. I'm the Academic Director for Nursing Programs here at the CUNY School of Professional Studies. I'm going to speak this evening about our undergraduate nursing programs and why you should consider CUNY SPS as a place for you to come back to school. This evening, we will speak about the RN to BS in nursing program that we have here. We'll also talk a little bit about our accelerated dual degrees for RNs, where you can get your bachelor's degree and your master's degree in one of the three graduate tracks that we have: nursing education, nursing informatics, and nursing organizational leadership. Let's talk a little bit about why it's important to go back to school and get your bachelor's degree in nursing. For one, it's a way to enhance your professional knowledge. I know that you all received a wonderful education at your community college associate degree program or your diploma program. You learned great clinical skills. You learned great bedside patient skills. I know this because I spent 15 years teaching at Queensborough Community College, which has an associate degree in nursing program. So I know the quality of associate degree nursing programs. When you transition to a bachelor in nursing degree program, we build upon those skills. We want you to learn about research. We want you to be able to look at evidence-based practice and how you can apply it in your setting. We want to expose you and educate you about community and public health nursing. We want to talk with you about global health nursing. We also have a focus on leadership and management in your capstone course, as well as informatics, health teaching, and an increased emphasis on health assessment, not just the physical skills, which you are all very competent in, but we also look at what are other things that we need to think about when we do a health assessment, and what are the social determinants of someone's health that don't necessarily have much to do with their physical assessment, but have a great influence on their state of health. So those are all ways that we hope to enhance your professional knowledge and make you a greater contributor to your patient care, as well as the healthcare facility that you work at. Another reason to go back is to enhance your employment opportunities. In the New York City and state area, it's very competitive to get a job in a tertiary care center. They're looking and requiring nurses to have their bachelor's degree for a number of different reasons that we will review. But by having your bachelor's degree, or at least being enrolled in a program, you open those doors and give yourself greater opportunities for mobility, flexibility, and advancement. It's also the first step that you need to complete in order to prepare for graduate education. And I can say with confidence that the job that you are doing today as a nurse will not be the job that you are doing 10 years from now. Most nurses move and transition throughout many different phases of the nursing profession. And that's one of the wonderful things about the nursing profession, that you can contribute in so many different ways. So if you're not thinking about graduate school at this point, it may be something that's very important to you in the future. And the first step for preparing for graduate education is to get your bachelor's degree in nursing. In 2011, the Institute of Medicine came out with a report called The Future of Nursing. And they came out with 4 main recommendations as they looked at healthcare delivery in our country. And they realized the value and importance of nursing in that healthcare delivery. Their recommendations included that nurses should be able to practice to the full extent of their educational training. They are more than just someone to take an order. They have the ability to assess, to look at interesting facts and concerning changes in patient care, and to make recommendations for how to address that. Nurses are the eyes and ears that see patients and then communicate that to all of the other healthcare professionals. And they should be able to practice to that full extent. The other recommendation they made was that nurses should achieve higher levels of education, in part because so much of healthcare today is collaborative and interprofessional. It's not just about a doctor and not just about a nurse. There are so many more components that play a role in keeping people healthy. And in order to be able to contribute to that in meaningful ways, the Institute of Medicine, in their Future of Nursing report, recommended that 80% of RNs should have a bachelor's in nursing by the year 2020. Well, we're not quite there yet, but we are making progress, and nurses are taking advantage of opportunities like online programs at CUNY SPS in order to advance their education. Nurses should also be full partners in redesigning how healthcare is provided in the United States. It should not be something that's just dictated to nurses. How many of you have been frustrated when changes have been made on your unit without any consultation to you, the nurse, who is the one that has to implement these changes? How much better it would be if they included nurses in those discussions. And that was exactly the recommendation from the Future of Nursing report. It's also important that nurses contribute to implementing information infrastructure and data collection, not only for managing patient issues from an individual patient, but also from a systems perspective, but also looking at workforce planning and policy making. How can we do things better? And nurses play a big role in that. Another reason and driver for nurses going back to get their bachelor's degree is the emergence of what's known as magnet status. Many facilities in especially the New York City area are aiming to achieve magnet recognition for their facilities. This is an American Nurses Credentialing Center sticker, if you want to call it, look at it like that. It is a recognition of the quality of care that an institution provides, and it's very focused on nurses and the quality of care that they provide. So in the magnet application, the standard is that 100% of nurse leaders must have a bachelor's in nursing or a master's in nursing, and 100% of their managers must have one as well. One of the newer standards that was implemented in 2014 said that 80% of registered nurses should be working to obtain a degree in nursing by 2020. Sounds a bit familiar coming from the Future of Nursing report, and that's exactly where it did come from. Now, it doesn't say that all the nurses in the hospital, 80% of them have to have a BS or an MS. It says they should be working toward it. And so your facilities should be supporting and encouraging you to go back to school and should be working with you to ensure that you can meet that goal. Because not only is it important to you, it's an important standard for the facility to meet. And that's something that you can present when you want to go back to school and you run into issues of flexibility and school time, etc. Here's an argument that you can present. It's not good just for you, it's also good for the facility. The Affordable Care Act, which was recently renewed, which was implemented in 2010, brought about new healthcare delivery models. There were changes in reimbursement. No longer do we operate solely on what's called fee for service, but now we work on what is the best care that can be delivered to the patient, who are the players that contribute to that care, what's the value-based components that we can provide to this patient, and it offers a lot of new roles for nurses. Leadership opportunities, case management opportunities, health coaching focused on promotion and prevention, which has a greater piece in the Affordable Care Act. We have increased use of technology for care management. From this Affordable Care Act emerged the driver for implementing electronic health records in our healthcare systems. And then, of course, the increased exposure and collaboration for interprofessional care. You don't just work with the doctor doesn't just work with the nurse. You have respiratory therapists, social workers, nutritionists, etc. And all of them contribute to the care and good outcomes for your patients. Lastly, in New York State, in January of 2018, the governor signed into law a requirement that all future nurse graduates of associate and diploma programs must earn their BS in nursing degree within 10 years of their licensure. People who had earned it before that are grandfathered in. They do not have to meet this standard, but it's wise to know that this is in place and that there will be an increased emphasis on it for people who do not have it. New York is the first in the state in the nation to implement this, and the rationale came from the Future of Nursing report. Nurses need to be able to meet the increasingly complex healthcare needs. They need to know about leadership. They need to learn about the processes of change, how to implement it, how to work together in teams, how to collaborate with interprofessional colleagues, how to apply and utilize evidence-based practice. How do you look at something from a public health and systems perspective so that you can change and implement population health care and not just care one at a time? So all of these are factors for why it's important for you to be thinking about going back to school to get your bachelor's in nursing. So when you are thinking about that, you want to look at what are the different programs that are out there. You have to look at and consider what works for you. Do they offer a program that suits your needs? Are you thinking that you want to go right straight through to graduate school and become a nurse practitioner? You might want to look at a program that offers both the RN to BS and a nurse practitioner program, so you can transition one into the other. Maybe you're not sure of what you want to do if you want to go to graduate school. And so look at what's available, what's flexible, what works for you. Look at the cost. You know that if you go to a program like CUNY School of Professional Studies, you're part of the CUNY system. CUNY is a very affordable place to go to school. Those of you that got your associate's degree at a CUNY school know that firsthand. And CUNY is the largest urban public university in the country. It's a well-recognized name, very affordable, and provides quality education. Look at how much time is it going to take you to complete the program? Where is the program located? Do you have to go to campus? Do you have to go on site? How many days a week is it going to do? Are you someone who prefers traditional face-to-face learning, which is what all of you are accustomed to? Or would you prefer to do something online? And do you know the difference between a synchronous online program versus an asynchronous online program? Here at SPS, our programs are asynchronous. What does that mean? It means our classrooms are open for students all day long, 24/7, 7 days a week for the entire semester. You are never required to log in and be in your classroom at a particular time and sit there for several hours. The classroom is there when you are ready to enter it. Programs that are synchronous function very much like a traditional face-to-face, except you log on a Tuesday from 6 to 9 at night, and you sit in front of your computer and you attend lecture. So what works best for you? Know that in an asynchronous program, you have to have good time management skills. You have to be independent. You have to be able to be organized and function. If you miss the camaraderie of being in a face-to-face class, then online might not be the best choice for you. So you have to make yourself a list. What are the pros? What are the cons? What works for me? Some online programs require you to be on site once a month, once a week. So what are those requirements, and are they requirements that you can meet? Here at CUNY SPS, we do not have any on-site campus requirements. We have optional ones, and we encourage and welcome you to come when you can, but we do not require you to be on campus on any particular date, day, or time. Every RN to BS program that's registered in New York State and that is accredited by CCNE or ASIN has to provide clinical experiences for RN to BS nurses. A lot of students ask, why do we have to take clinical? We already did so much clinical in our other programs. And the reason is the focus is different. The clinical focus is not on med-surg or peds or OB or psych. It's on community and public health, and it's on leadership and management and quality improvement. So those are the clinical areas of focus that have to be addressed in order to be issued a Bachelor in Nursing degree. Those are the state requirements. Those are the CCNE requirements. We'll talk a little bit more about how that clinical is implemented. It does not require you to come to campus, but it does require you to attend a clinical site, and we'll talk about how that can be implemented. How many credits will the program accept? The number of transfer credits accepted as SPS is up to 105 credits. Most students transfer in someplace between 75 and 85 credits. You can have a transfer credit review done before you even come to the school. You can make an appointment and have that done so that you have a good idea of what it is that will transfer in. The more credits you can transfer in, the less credits you have to take and the less money you have to pay. So those are some things for you to think about when you're looking for programs. Another thing to look at is, when do they admit? There are some programs that will only accept students in the fall. At this program, CUNY School of Professional Studies, we admit students in both the spring and the fall. What's our focus here? We focus on cultural diversity. We are one of the most diverse programs in the New York area. We look at the importance of the role of the nurse as an educator, educating patients, clients, colleagues, staff. We feel that that's an important piece of who you are as a nurse. We focus on interprofessional practice, and we develop our models of clinical opportunities for you to be able to engage with other healthcare professionals. We look for application of evidence in practice, such as our quality improvement projects that students do in their capstone. And we look for you to develop leadership skills, to implement your knowledge and contribute that to the different clinical sites, as well as in the classroom. So CUNY School of Professional Studies is a part of the City University of New York. It's CUNY's online school. And we have been CUNY's online school for the last 15 years. We are ranked 8th in the nation for best online bachelor's degrees for 2021 in US News and World Report. And that puts us in the top 2% nationwide. And that speaks to the quality of our programs, our responsiveness to our students, the flexibility that we work with you in order to achieve your degree. We are accredited by CCNE, which is the Collegiate Commission on Nursing Education, as well as registered with the New York State Education Department. So who are our students? They're working adults. Some of them are in career transitions. They have their own families. They have a lot of responsibilities. They need a degree that's going to fit into their schedule. And as you engage with students in our programs, you'll find that you meet people from all over the world. We don't just have students from the United States, in particular in our general education courses, but from all over the world. And that's a wonderful opportunity for you to experience diversity and different perspectives. I do see that there are some questions posted in the Q&A, and I'll be happy to get to them towards the end, so please be patient. The student services that we offer, every student participates in what we call the online new student orientation. This is done before the start of the semester, and it's an opportunity for you to engage in what's it like to learn in the online environment at CUNY SPS. There is a orientation facilitator. You learn about different tips, time savers, strategies, best practices, and ways that you can navigate your online course. This is about a 2-week-long orientation. So know that when you apply, if you're accepted, this is something that you will need to complete as part of your transitioning into school. We find that students who complete this program are more likely to persist and complete onward to graduation. And we require students in the nursing program to participate in this orientation. We also have nursing peer mentors who are students that are currently in the program or have graduated the program that work with you in the orientation site. They're available to answer questions and help guide you in the different processes. Everyone gets a dedicated advisor that stays with you from the minute you start attending CUNY SPS until you graduate. So you always have that same advisor who will work with you on a regular basis every semester to plan your academic schedule, to help you with any issues that come up, and to stay in touch with the nursing department as well to make sure that you're on track to get to your goal, which is your bachelor's degree. We do offer tutoring in writing, in math, and other subjects as well. When the campuses are open, we have them online. We have them on campus, and we also offer these tutoring services online as well. We use the CUNY library system. Our home library is Baruch College, which is located on 23rd Street and 3rd Avenue in Manhattan, not far from where our own campus is located on 31st Street and 6th Avenue. And the wonderful thing about being part of CUNY is that you have access to all of the CUNY libraries, and you can access them all online. We have a help desk to provide you technical support. We also have a career services department to help you with resume preparation, interview preparation, building your social media profile, how to take advantage of different opportunities in order to enhance and accelerate your professional career. So what are some things that are unique about our program? Well, we admit you directly to the nursing program. Unlike some other programs, when you apply to CUNY SPS, you are admitted to the nursing program and you can start nursing courses right away. In fact, we encourage you to start nursing courses right away because we want you to be part of our nursing community. We're not like other schools that make you take prerequisites and then establish a residency in the college and then apply to the nursing program and sometimes find out that they don't accept you. If you apply to the nursing program at CUNY SPS, you're accepted and you can start nursing courses right away. We have no time limit on your science courses. So one of our program requirements is chemistry. Another science requirement is pathophysiology. If you took them 5 years ago, we accept them. If you took them 10 years ago, we accept them. We don't have any time limit on when it was that you completed them. They're completed and you can transfer them in. We offer courses in the fall and spring over the 15-week semesters. We also offer courses in winter session, which is 3 weeks, and summer session. We have a 7-week summer session. We also have a 3-week summer session. We don't advise students that are just coming into the program to start with a 3-week course. We do have a first-year nursing course that we do offer over the summer, and we do that actually over a 10-week period, just that particular course. We have a very special Nursing Now, which is our new nursing student orientation workshop, and that is a live event that we do by Zoom right now. In the past, before COVID, we actually had students come on campus. Once we can open our campuses fully, we will resort to that again. And that is about a 2-hour session where you get a chance to meet with your colleagues who are coming into the program. You get to meet faculty as well as all of the student support service people that will be working with you over the course of your time here. We have a Petrie Nurse Scholar Program. This is a special scholarship only for nurses who have graduated from a CUNY Community College nursing program. You must have completed 6 credits in order to be able to apply for it, 6 credits here at SPS. If you are accepted as one of the scholars, then your tuition is fully paid for the remainder of your time here at CUNY SPS. So that's a wonderful opportunity. And we have about 9 to 10 Petrie Scholars that are awarded each year. We also have a Career Ladders Scholar Program, and this is a scholarship that's aimed at minority men in healthcare services, including nursing, health information management, and Health Services Administration. You can apply for this scholarship in your very first semester. It doesn't provide full tuition, but it certainly provides a good amount that it can help with your tuition as well as with purchase of some textbooks. And finally, remember that we are part of CUNY. And so we are CUNY, we are quality, we are a wonderful opportunity, cost-effective, efficient, and we provide a quality education with a name that's recognized across the country. Some of the unique activities that we engage in here at CUNY SPS, we use virtual patients for our health assessment and our advanced graduate programs. This is an online patient model that you can participate in as far as assessment and management of care. We have a standardized patient program that we partner with the New York Simulation Center, which is housed in Bellevue Hospital. It's a joint venture between NYU Medical Center and the City University of New York. And we also engage in some interprofessional education learning experiences, both in our clinical placements, as well as with a unique interprofessional education simulation experience that students do in their capstone course, where you have an opportunity to work with students from social work, nutrition, respiratory therapy, physical therapy, medical school, etc., and all engaged in an interprofessional simulation session that focuses on particular patient cases. So again, a focus of our programs here is on caring for diverse kinds of patients, but also promoting interprofessional collaboration and education. So what's it like to learn online at CUNY SPS? As I mentioned earlier, our classes are asynchronous. That means the semester opens, the first day of class, you have access to your classroom, and you can enter that classroom anytime that you want, any day that you want. You will have weekly work that you will have to complete, but there is no specific time or day that you have to be in the classroom. We keep the classes small, usually 18 to 20 for nursing classes. You need to think about time commitments. So you're not traveling to a campus. You're not spending 3 hours sitting in a lecture and then traveling home, but you should plan on allocating 9 to 10 hours per week for every 3-credit course that you take. That does not mean that you have to be in the course site that amount of time, but it does mean you'll need that amount of time to spend on your readings, your lectures, your videos, your discussion boards, your assignments. So that's something to plan out in your calendar to make sure that you have time to do that. You do need to have a computer, and you do need to have Wi-Fi access. You cannot rely on the local store for their Wi-Fi. You cannot rely on your work for your Wi-Fi. You have to have a reliable Wi-Fi source so that you can complete your assignments. A lot of students do complete their assignments using mobile devices. There is flexibility for you to be able to do that, but not everything will be able to be done just using a mobile device. So you will need some type of computer. And as I mentioned, there is a 2-week online orientation with peer mentors that takes place before you start classes, so you can be better prepared to be successful. So some time management tips from students. Plan for your weekly work. Figure out when are you going to allocate your time to do your work. Map it out on your calendar. If you need to, find a place where you're going to go and do that so that you're not disrupted or disturbed. Many of you had to do this when you went through your pre-licensure program. So the model is still the same. You need to make time for reading your work, doing the research, responding to the questions and the assignments. You do need to have a computer. You do need to have Wi-Fi access. As I mentioned, you can do a lot of this stuff using mobile devices. You do need to know where to go to get tech support, and we do offer that to you here through the help desk. This is a little video that we provide to you that's actually made by some of the students at SPS about how they managed their time while they were students at the school. You'll have access to these slides after tonight's session, so you can watch that on your own time. Some student perspectives about how to complete and stay focused. Set your due date the day before an assignment or posting is due. So in nursing courses, we always have day 1 is a Monday and day 7 is a Sunday. Discussion posts are generally due on a Thursday, and peer responses to those discussions are due on a Sunday. Assignments are generally due on a Sunday as well. There's usually about 10 to 12 discussions. There's usually 3 to 5 major assignments. You'll know what everything is at the start of the semester, so you can map out. And a very good piece of advice, as J.C. Lindrum said, set your due date so that you complete it before the actual submission due date. Don't procrastinate. You don't need to clean out 3 closets or do 2 loads of laundry before you sit down and do your homework. Make your work a focus that's important and is a priority. Get a planner, whether it's digital or the old-fashioned paper, so that you know exactly where you're plotting out your time, and always give yourself a cushion. If something happens and I'm not able to do my work on this day with this block of time, when can I add that in? When can I get it done? Because life happens. Somebody in your family may become ill, and you as the nurse have to bring them to the doctor or to the emergency room. Maybe there's a snowstorm and you get called in to work overtime, and that 3-hour block of time that you plan to do your work is gone. Be proactive. Seek guidance from your instructor. You would never just not show up for work without calling your supervisor. So apply the same principle to the classroom. Be that professional self that you are. Reach out to your instructor and say, this happened. Can I have an extension on when I can submit this? And most of our instructors will be very accommodating because they understand that life happens. You just don't want it to be an ongoing habit, because if it is, it means you've put too much on your plate and you need to think about what you can manage in your life with all of your responsibilities. If you're feeling overwhelmed by school, remember, just deal with the here and now. What can you do today? What can you do in the next 5 minutes, 10 minutes, 15 minutes, 1 hour? And check that off for a sense of accomplishment. And always remember, you're already very accomplished. You made it into your nursing programs, passed the NCLEX, and got your degrees. So you've already done much. If you can do that, you can do this. This is an example of what our courses look like. We use Blackboard for those of you that have been in CUNY schools. That is the platform for learning management that functions in CUNY. We have titles. In this case, this is Nursing 301, Health Assessment. All of our menu items on the left there, we try to keep consistent so you always know where to find the particular announcement. Who's my instructor? How do I contact them? What are the weekly things that I have to do? What assignments are major? My discussion board, etc. So we try to keep it consistent so it's not confusing from one course to the next. Here you'll see a weekly module. So as I mentioned, we try to start every week on a Monday and end it on a Sunday. That gets a little tricky at the start of the semesters because CUNY never starts on just a Monday. So we make adaptions. And each weekly module lays out exactly what you have to do, what you have to read, what are your discussion board assignments this week, and what other tasks do you have to do. So you'll always know exactly what you need to do. It's posted here in your course site as well as in your syllabus. The RN to BS nursing curriculum is 30 nursing credits and 9 program credits. Now remember, a bachelor's degree in nursing, just like any bachelor's degree, is 120 credits. You will transfer in someplace between 75 to 80 credits from your previous degree. You have to achieve 120 credits. 30 of those credits are going to be nursing credits. 9 of them are going to be program credits that you can transfer in from your current school. If you took chemistry at your school, it transfers in. If you took statistics, you can transfer that in. If you took pathophysiology, you can transfer that in, just like you can transfer in the gen ed and general elective courses. The 30 nursing credits have to be taken at SPS. In addition to or as part of the 30 nursing credits, you have 1 3-credit nursing elective. And I'll talk a little bit more about ways that unique ways that you can meet that requirement as well. You'll see we have 2 clinical courses, community nursing and capstone in leadership and management. And these are some recommended sequences. Again, we will give you access to these slides so that you can see them. Everyone follows a different path. You do not have to take courses that everyone else takes. As I said, we do encourage students to start with nursing courses with our first transition to professional nursing course, Nursing 300. We generally advise students when they first start, take 2 courses, take 6 credits, get yourself accustomed to online learning. After that, you can take more credits if it works for you. Keep in mind, for each 3-credit course, you need to budget about 10 hours a week. So if you're taking 3 courses, do you have 30 hours a week to be able to give to your schoolwork? So think about it in those lines. I can tell you that 95% of our students average 6 credits a semester, and that includes fall semester, spring, and summer, and 3 credits in the winter if they so choose. So you can move through the program quickly, but it's really very individualized for what will work for you. Look at your life. How many hours a week are you working? How many children do you have? How many other family responsibilities do you have? So you need to be able to plan accordingly. And just a reminder, all RN to BS nursing programs registered in New York State must have clinical requirements to address BSN roles. CCNE accreditors require all RN to BS in nursing programs to provide clinical experiences to complete the BS in nursing. So this is a mandate. This is not something that I decided or the school decided. We are following the regulations that we are provided in order to be able to award the degree to you. I mentioned we have 2 clinical courses. One is community and public health, and the other is the capstone in leadership and management. And how can you meet those clinical requirements? Well, you can arrange to do your own clinical. We encourage students to look at their place of work. They can set up an opportunity that gives them a lot of flexibility, work with a preceptor at your facility, and you can do it at your flexible time frame that works for you and your preceptor. Or if you can't work that out, we will offer placement for you. But because we're placing so many students, it has to be a little bit more structured. So students can choose the first 7 weeks of the semester or the second 7 weeks. And we usually place you at a senior center or another community-based program as well. So keep in mind that it's a 45-hour clinical. So that averages out to 1 6-hour day for 7 weeks. And again, students can choose to do that at their place of work, or we can offer assistance. But if you ask us to place you, you need to be prepared to be flexible with the options that are available with our clinical partners. Same is true for our capstone in leadership and management. This is a 90-hour clinical. And so that works out to be approximately 1 6 to 8-hour day for about 15 weeks. Students can do this at their place of work, and we encourage them to do so. because this is an opportunity for them to see their place of work from a different perspective and focus on quality improvement and patient safety. It is something that has to be done over the entire semester. This is not a project that you can do in 1 week or 2 weeks. So you have to be prepared that you have to allocate 1 day a week for clinical. Preceptors and sites generally are available for this kind of a project during weekdays, Monday through Friday. So you need to take that into consideration when planning. Students can self-select a preceptor and a clinical site. As I mentioned, this can be your place of work, or we can offer some assistance as well. Keep in mind, if you ask us to place you, you have to be flexible and you have to be willing to go to the site that is available, and you have to be willing to give your time when they say that the students can come to their particular site. A little bit about prior learning assessment and transfer credits. There's great opportunities for your general education courses, a lot of different ways that you can add credit to your degree. A number of our students actually complete pathophysiology and other general education course requirements by examination. So you can look at that. It's a less expensive way to earn a credit than taking a course over 15 weeks. We also have what's called credit for non-collegiate learning, and I'm going to talk a little bit about that. So this is specific to the nursing elective, which is 3 credits. And we have been approved by the State Education Department to award nursing elective credit for professional certifications that nurses may have, such as a certified emergency nurse or a critical care RN or a certified wound ostomy nurse. A very popular certification that many of our students employ is ACLS and PALS credentials combined can be awarded for 3 credits of the nursing elective. So details about that are on our webpage, and that's the web link. So these are the current tuition and fees. We have not been received information about increases in tuition, so we are still operating at the 2020-2021 rates. This is the same tuition is offered to students whether you're in-state or out-state. So that's a wonderful advantage for students that end up relocating for whatever reason. They can continue in the program and still pay the in-state rate. It's one rate. I know it's attractive to look at taking 12 credits for the full-time semester rate, but I do urge you to think about what your life looks like, what your responsibilities are, and can you really manage 12 credits? And I would never encourage a student just starting an online program to enroll in 12 credits unless you weren't working and you had no other major responsibilities. Start with 2 courses, start with 6 credits. You can always add additional courses in subsequent semesters. You can always take classes in winter and summer, and you will complete the program. What's the admission criteria? Well, you need to have a diploma in nursing or an associate degree, which is often issued through a community college program. You need to have what's called an unencumbered New York State RN license and current registration. We do accept a number of new graduates if they apply in the last semester of their program before they get their license. This is done on a case-by-case basis. It's based on GPA, nursing and science grades, your essay, your personal statement that you have to write. So not every student that is pre-licensure and applies will get accepted right away into the program without their license, but we do select a number of students in this category. You have to submit a 250-word essay. We do have a GPA requirement of 3.0. All of your official transcripts from all schools that you went to, not just your nursing school, have to be submitted. That is a state requirement. And the application is easily filled out online using the Apply Now button right on our webpage. Fall admission applications, priority due dates are April, and the regular due date is June. Spring admission applications, priority due date is the first week of November and a regular due date of December. What's the advantage of applying early? Well, you get a response earlier, and so you'll know what your status is. A little bit about our accelerated dual degree program. This allows you to complete both the BS and the MS, 150 credits for both degrees versus 165 if you did them one and then another, because we're allowed to apply select graduate courses towards the bachelor's degree. And our BS MS programs focus on our graduate tracks, one in nursing education, nursing informatics, and nursing organizational leadership. An important thing to remember is that both degrees are awarded on completion of the entire program. So you do not get the bachelor's degree when you complete the bachelor's components, although I can provide a memo if that's something that you need to say that you have completed all the BS requirements. But the degree itself is not awarded until you complete the entire program. And those are the due dates. Again, an early due date and a regular due date allows you to get an earlier response with the priority due date. This is the courses, and you can see the substitute courses satisfied by the graduate program. Again, we'll make these available to you so you can have them. These are some of the core courses for the graduate program. And then we have the specialty courses, which include a practicum. Every degree has a clinical component. So for nursing education, your practicum is going to focus on nursing education. Informatics, going to focus on an informatics project. And leadership, same thing, you need to do a clinical experience in nursing leadership. Admission criteria, you have to have your license to apply to this program, and a GPA of 3.0 or better. A few more options included in this application include 2 letters of recommendation, your resume, as well as a description of an evidence-based practice project. And what do we expect in that? Well, it might be your capstone project from your undergraduate program, or it might be a quality improvement project that you were involved in at your facility. We certainly don't expect you to be the lead on the project, but if there was a new fall prevention policy implemented at your facility, what was your role in it? Why was that policy changed and newly implemented? Can you provide evidence as to why this was done and support it? So these are some examples. How did you participate in it and implement it? Describe the rationale for the project and the evidence behind it, and include some references to support that. The application is also on our webpage. You must select the specific program, the RN to BS, the RN to BS MS in nursing education, informatics, or leadership. And to apply, you go to the CUNY application site on the CUNY website. If you are already a CUNY student, you can use your CUNY First account. If you are not a CUNY student, you can see that you would start your application there on the left. You would apply as a transfer applicant because you already have completed an associate's degree. So be sure that you consider that when you're completing the application. And you will see that SPS is on the list of all the CUNY schools that have RN to BS programs. So be sure to select SPS if you decide that's the right place for you to go. So in closing, I want to remind you that shift happens. And this is a hyperlink here to a little video that I think would be interesting to you about the introduction of different technology and different ways the world has changed just in the past few years. You can watch that on your own time. Will you be prepared? In the old days, we had paper charts, color-coded by patient and by discipline. Now everything is digital and electronic. We had clunky desktop computers. Now most of us operate with smooth laptops or tablets. We're going to see more changes in your lifetime, in your professional career. The most important thing is you prepare yourself for that change. You can't know what's coming, but you can know how to gather the information, the research, and the necessary things that you need in order to be able to function and excel in such an environment. For more information, here is our webpage. This is the CUNY phone number that you can call for further information. This is our SPS nursing email, and you can find us on Facebook as well. And this is our link to our Facebook page. So I'm happy to look at some of our Q&A questions, and I'm going to open that up now. And thank you for your time. Do you need to be an RN in order to join the BS in SPS if you already have a BS in Health Services Administration? Yes, our program is for students who already have an RN license or are in their last semester of a pre-licensure RN program. And I think I answered this question early about, are there clinicals for RN to BSN? Yes, those are state requirements from both the New York State Education Department as well as CCNE. Good question, international students. So since we are an online program, we are not approved by the federal government to renew F1 student visas. Students in that category need to go to a school that's a brick and mortar school offering face-to-face classes. So unfortunately, federal government does not allow us to do that. Someone wanted to know how long are the RN to MS accelerated programs? And well, honestly, it really depends on how quickly you move through the program. So for instance, if you have to complete 150 credits for the RN to BS to MS. Am I asking the right questions? Yes. Say you transfer in 80 credits so that you would have 70 credits to complete. It's really math. How many credits do you want to complete each year? How many are feasible? So most students complete our RN to BS program in either 15 months to 2.5 years. Those that are in the RN to BS program usually finish that in about 3.5 to 4 years. So they're getting their bachelor's degree and their master's degree in an average of 3.5 to 4 years. But it really does depend on how many credits you transfer in and how many credits you're willing to take on an annual basis. Once you know how many credits you've transferred in, subtract that from how many you need to complete and figure out how many credits do I want to do each semester in order to reach my goal. And that's where your advisor will help you. Also the transfer credit review that's done. Somebody wanted to know about having a bachelor's degree in bioscience, which is focused on science classes. Can you transfer credits to the RN to MS program? We can accept some transfer credits to the bachelor program, depending on what it is you're transferring in. We can also accept some graduate courses, but they have to be graduate level courses. We're limited in the number of graduate level courses we can accept. We have more flexibility with undergraduate or bachelor level courses. Someone asked about how long is the program? I think I answered that. And are there winter, summer classes? Yes, there are. Do we have to complete chemistry and patho prior to applying to the program? Great question. No, you do not. We invite you to apply to the program. If you're accepted, we encourage you to start nursing courses right away. And we want you to take nursing courses right away. Take them in conjunction with your other program requirements and gen ed courses. So take nursing and gen ed courses as you move through the program. So you can complete them while you're here at SPS. You don't have to complete them before you come into the program. For the RN to MS programs, what is the deadline? I think I mentioned that first week of November is the priority for both types of application. First week of December is the regular deadline. Scholarship options. for the RN to MS program? Great question. We do have the Petrie Scholar, but we do have other scholarship programs on our scholarship page that you can look at. And all students, if they're eligible, can certainly apply for financial aid. And that information is available to you as part of your advisement session with your academic advisor. Student who wanted to know for clinical, when the school helps to choose a preceptor, can they choose a location that's close to where the student lives? Well, we place over 250 students every semester. We do the best that we can. What I can say is we try to look at where you live. I can't say that you'll have a site around the corner, but if you live in Queens, we will try to find a place in Queens. If you live in Brooklyn, etc., we do the same. But if you want something that's within walking distance of you, our best response is that you do some work and identify the site, and we will help facilitate that, because it often will mean getting a contract, but we're happy to work that out with you. The slides will be sent to you by our marketing department at the conclusion of this event after they have been converted. So it may take a couple of days, but you will get a link to this session. If you don't have an evidence-based practice project, can you still apply? Well, what I would say is, if you're currently working, what are the evidence-based projects and quality improvement initiatives that you're doing in your facility? Every single facility has a quality improvement initiative in place. And that's true whether you work in a hospital, whether you work in home care, whether you work in a long-term care facility, whether you work in ambulatory care. And that's because Medicare and insurance companies require that there be a focus on quality improvement. So every facility has one. Maybe you focus on something when you were in your nursing school, and you can talk about that. So those are some suggestions for you. What if you applied through BMCC and were accepted to SPS? You don't need a license to get in. That I'm not sure. If you're referring to the dual joint program that we have in partnership with BMCC, that is correct. If you were accepted as a dual joint student at BMCC, you can transition right to SPS before you have your license, but you do have to earn your license by your second semester. Exams are always online, and most of our coursework is not exam-based. Most of it is writing. Most of it is assignments. So we have actually very few exams. So you'll have a great emphasis on writing assignments. What are the general education courses that are required for the program? You have to meet the general education requirements for the degree. And so if you are from a CUNY school, you have to meet what's called the pathways requirements, but you also have to meet, you have to have at least 60 credits in Gen Ed for the Bachelor in Nursing. You should have earned at least 30 credits at your CUNY associate degree program, so you'll need to complete another 30. If you completed them as a college student elsewhere at another time, those can transfer in. But the bottom line is you need approximately 60 general education credits in order to apply to the bachelor's degree, which is 120 credits. Can we start taking the clinical class on the first semester? No, you cannot. There are prerequisites to these courses. You also have to have your license, and that has to be verified. So the earliest students take the first clinical course is in semester 2. Can anyone with an associate in another major go into nursing, a bachelor's in nursing? You have to have a nursing degree. So you either have to have your RN license, or you have to be graduating from an associate degree in nursing, and you are eligible to be licensed. 2 clinical courses means that there are 2 semesters of clinical in total. Yes, and we usually suggest to students that you save them for your last year, first one and then the other. Are credits in chemistry gained at an international school transferable? If it has been evaluated by the university's admissions processing center, yes. So make sure that your international transcripts are submitted. If you went to another CUNY school, make sure they were evaluated and you were given credit for it there. If not, that will be done by our admissions department, and that has to be approved by our University Applications Processing Center. Where must the letters of recommendation come from to put into the application? This is an online application, so you identify who your reference person is, and then they're automatically sent a link that they complete and that they submit. So it automatically gets added to your application. Do I have to start an application in order to get a transfer credit evaluation? No, you do not. You can do the transfer credit evaluation before if you choose to. You said you started one a month ago and you haven't heard anything. I would suggest that you contact the person that you connected with so that they can follow up with you. Timing may have a lot to do with it. If you did your transfer application during the last month, when there has been massive registration to start the fall semester, that may have been the priority to do the transfer application review for all of our incoming students. But I encourage you to follow up with the person that you connected with for your transfer application review. If you live out of state, can you still be placed by the school to a clinical site? We can help facilitate that. But you will need to work with us. So we do have a handful of students that live in different states. And what we advise those students is to look to their place of work, connect us with the contact person. We can help set up a contract if it's required, and we can facilitate that. But we don't have clinical sites across the country that we can say, you can go here or you can go there. It really becomes a partnership between you, the student, and the school. Do prices vary between classes? The classes are CUNY tuition based. So the classes are, a 3-credit class is going to cost you whatever the tuition is for a 3-credit class. I think it's about around whatever we posted earlier. So you just multiply that amount per credit times the 3 credits. So it'll always be the same. What will be different is what's an undergraduate tuition cost versus a graduate tuition cost. So when you're in the dual degree program, the BS, MS, once you finish 120 credits, and then the remaining courses you take are graduate credits, you will be charged graduate tuition. If we are in need of clinical placement from CUNY, is it only senior centers, no hospitals? What I said was the focus has to be on what the purpose of the clinical is. So if the clinical is focused on community and public health, and then it has to focus on patients that are outpatients. Examples include senior centers, home care, ambulatory care centers, which is a common place that many students who are working in hospitals choose to do their clinical experience for community and public health. For the quality improvement capstone project, that can be done anywhere. It can be done in a hospital. It can be done in a home care agency. It can be done in a long-term care facility. It can be done in an ambulatory care unit. It can be done in a school. So many, many opportunities for quality improvement projects, not just limited to hospital settings. Can you send an application for the summer or winter semesters, or is it only for fall and spring? Well, you have to apply to the school, and the applications are due in the fall for the spring semester. The applications are due in the spring for the fall semester. If you are accepted in the spring semester, you can start taking courses in the spring, and then you're eligible to take courses in the summer as well. So we don't have specific applications for summer or winter. Do they have to be nursing related for the letters of recommendation for the BS-MS program? As per the application guidelines, you have to have a recommendation letter from a nurse educator, and that can be a nursing faculty from your previous program. It can be a nurse educator that works with you at your place of work. And you also have to have a recommendation letter from a nurse manager or anyone that supervised you in a healthcare facility, nursing related. And another question, what is the acceptance rate? Good question. So we have about an 80% acceptance rate. So this past year, we reviewed over 200 applications, and we accepted about 170 students. So it depends on the semester, and we are happy to review and welcome as many students as we can. We don't have limits because we are online. So we don't have reserved seats, a reserved number of seats. We do have the capacity to expand beyond the numbers. So it's based on the number of students that we accept into the program. I'm just going to take a quick look at the chat to see if there's anything specific here. I don't see, I do see one specific question about general education. Are those classes online as well? Very good question. Yes, we offer all of our classes online, both gen ed and nursing. Unlike some programs where only nursing classes are online, we offer all classes, both gen ed and nursing. Okay, let's see. Okay, I think that's most of our questions. Very happy to answer any other follow-up questions that you may have. Thank you to those of you who stayed late to hear the responses, but you can always follow up to our nursing@sps.cuny.edu email. We're happy that you joined us, and we wish you lots of luck in your journey to your bachelor's degree and further education as a nursing professional. Thank you all for attending.